Hi, I'm Minrui. Today the disease I'm going to talk about is a cystic fibrosis, which is called CF. So we are healthy people. We can breathe freely. So for our healthy normal people, we have the cystic fibrosis transmembrane conductance regulators, which is also called CFTR channels. We have the normal CFTR channels, and it is a protein that allows transport of chloride ions across airway epithelium and create open airway with thin watery mucus. But for people who are suffering the cystic fibrosis, they having some dysfunction of the CFTR channels. So this disease is an inherited disease that affects mainly the lungs, the pancreas, and the sweat glands, and is caused by mutation in the cystic fibrosis transmembrane conductance regulator CFTR genes. So it causes increase in sweat electrolyte concentration, progressive lung disease with chronic inflammation and recurrent bacterial infection. Sometimes it may also cause pancreas insufficiency and male fertility. Among these problems, lungs issue is one of the most severe issues. And in the worst case, it may block the airways. There are 5 different classes for CF disease. But today I'm going to talk about the class 2, no maturations. That is the CFTR failed to mature and is degraded by the protease in ER. It happens in position of genes 50A, which need to a change in protein. So for the disease physiology of CFTR channels, they present fewer CFTR channels, unable to transport the chloride ions across the airway epithelium and resulting in constricted airway with thick, sticky mucus. But compared to the normal ones, what happened? Why this happened? So normal physiology, we have when the chloride ion leave the cell, there is an imbalance created which draw the water out of the cells through osmosis, and water keeps mucus moisturizers and which prevent the infection and maintaining ciliary functions. But for disease physiology, CFTR does not function properly, and chloride ion cannot leave the cells. Thus, there is no imbalance of chloride ion, and water does not leave the cell. And there's no water in the airway, mucus get thicker, and cilia cannot beat properly. Thus, bacteria are allowed to collect on the cells, and infection can occur. Also, symptoms may vary. They can include cough, repeated lung infections, inability to gain weight for other affected organs, and maybe fatty stools. Patients may also have shorty skin, thus one of the diagnostic methods is sweat tests and genetic testing, which is a DNA screening. But for current treatment, there is no cure for CF, but the treatment can only ease the symptom and reduce the complication. Purpose of treatments are to prevent and control the infections that occur in the lungs, removing the loosening mucus in the lungs, and or preventing the intestinal blockage, providing enough nutrition. And the current treatment may include the medications such as antibiotics to treat and prevent the lung infections, anti-inflammatory medication to lessen the swelling in the areas in the lungs, and also the mucus thinning drugs to help cough the mucus and improve the lung function. Other drugs may include Ivacaftor and Orkambi. And we also have the physical therapy for the current treatment. So it's the chest physical therapy to help loosen the mucus. But there are different classes of CF may use different treatment. For what are the new treatment available from research? I will now give you a new treatment for lung infections. So in addition to bacteria, fungi are also detected in a significant number of patients, and impact of fungi colonization of the airways is still not completely verified. But currently, the treatment for fungi pulmonary infection is limited to few drugs, and with relevant side effects, drug interaction, and variable host response. First, the decisions regarding when to commence treatment and with which agent is used which agent to use is a challenge. There is a new drug called PI. In the PI, it's called T2307. It's a relamide derivatives. It exhibits potent broad spectrum activities against clinical significant pathogens, including the Candida species and Aspergillus species. In the research, when you use the T2307, it may interfere with the mitochondrial function of the yeast. So the T2307 can selectively disrupt the yeast mitochondrial function, and it was also demonstrated that the fungus mitochondria is an attractive antifungal target. So how this will benefit the patients? So such as new drugs potentially benefit CF patients to prevent this type of infection or treat patients who are suffering from fungal infection. So here is the reference of my presentation. Thank you.